Being very uncomfortable around food. Holidays are a very stressful time because how many of our families focus their holiday time around the mealtime? Complaining about being too fat even when they're noticeably thin. Cooking for others and not eating themselves. They really are not, well, I nibbled my way through. They really aren't. If you actually sit there and watch them do it, they don't. Restricting food choices. Guilt or shame about eating. You will hear them say things like, I can't believe I ate that. And you will look back and you think, what did they eat? Because if you're not paying attention, you don't think, yeah, and you feel to go right along with them. I can't believe I had that cheesecake. And they're like, they had a cracker. But they're not going to tell you that. They're like, I know, wasn't it great? And they'll tell you like they ate the cheesecake because you didn't pick up on it. But they will honestly, genuinely feel guilt and shame about eating. And sometimes, I guess I shouldn't be extreme. A lot of times it's not the cracker. They probably had cracker with some cheese. Depression, irritability, and mood swings. This is particularly something to pay attention to with teenagers because that's what they look like a lot of their teenage life. But I'm actually not even saying that tongue-in-cheek. They really do. And unfortunately, a lot of teenage depression gets missed because irritability is one of the primary ways for teenagers to present. And it is not unusual whatsoever for me to have someone coming in for depression, and I discover that in the recent 6 months they've been engaging in what I consider disordered eating. They don't meet the full criteria for a true restricting diet, but they go through episodes, particularly relative to relationships, where they aren't eating, or they will go days and days with not eating, or prom just happened. I cannot tell you the number of times I had a talk with people about, well, I'm going out, we're going out to dinner beforehand. It's like Texas Roadhouse, and you know that all those carbs and all that bread. I'm not going to eat Thursday or Friday at all, and they won't. They'll eat it, they just won't eat in advance. In their mind, thinking they're giving themselves permission then to eat what they want to eat when they go out. Of course they don't, and that's assuming they even eat it all, and they even keep it down. But then they won't eat for the next 2 or 3 days afterwards to punish themselves for eating. Despite the fact that we go through the thought process, but you gave yourself permission, remember? Because you didn't eat on Wednesday, Thursday, or Friday. But it doesn't work like that. Their idea of, I'll be okay when I reach a certain weight, it's never when they get to that weight. It's always going to move. Well, and they base their value and their opinion of themselves on what the scale says that morning, or the 12th time they've weighed themselves that day, because they will do that. One of my treatments usually requires talking to the family about removing all scales. And then when they weigh them, when they come into me, I have them stand on the scale backwards, and they don't get to see it. And they'll come in and they'll sneak. I even had one girl that would adjust her glasses. She figured out finally what she was doing. She could angle her glasses so that she could see it in some kind of reflection. It was pretty smart, because it was so important to her. But I appreciate that she was trying to be honest, because that probably meant she wasn't weighing elsewhere. And then I discovered she was going in to talk to the dietitian all the time, and the dietitian didn't know that I had asked them not to weigh, which is pretty much a standard practice. So she was coming in and to talk to the dietitian, and the dietitian was really excited because she was very interested in her coming in and talking with her. But she later confessed it was about the weight, and she wanted to know, because that's what they base their value on for themselves, and was what that scale said. And it was very frustrating if they didn't get to use the same scale, because they wouldn't trust it. Other symptoms to be looking for anorexia are evidence of vomiting, laxative, diet pills, diuretics. I worked with a girl once who lived in a dorm, who their floor, like I told you, because they all come in groups, I'd say about half her floor, there was like 15 of them out in the waiting area, and I thought, which one's the anorexic? And actually probably several of them were struggling with it. She wouldn't go to the bathroom in there. If you remember what dorms are like, at least this particular dorm it was sort of the communal bathroom, the stalls where there's 6 or 7, and you can't really get sick without people hearing it, especially echoing in the big cinder block rooms. So she would vomit in jars in her room. And we kept them under her bed. And when her roommate would go, I know, sorry for those people at home who are a little sensitive stomach. When the roommate would leave for the weekend, or when she'd get up at 2 o'clock or 3 o'clock in the morning, and she'd have to work at it because it's college and kids are up at all hours of the night, and would sneak it down when she was doing laundry, and would have this heavy bag that she would be dragging down there. And it was finally an RA that happened to be doing rounds at the time. That's the depths that we go. And she had such shame and such guilt about that. But can you imagine, the depth that she was going through in order to do that behavior? Wearing baggy clothing to hide their weight. You hear stories about people who are pregnant, and families don't notice it, and they deliver full-term babies. Especially if it's wintertime, you can hide a lot of weight change in baggy clothing. And if you consider that people can lose weight very rapidly when they're only eating 30, 40, 50 calories many days a week. They can drop weight pretty fast, and as long as it doesn't show too much in their face, they can get away with quite a bit of it. And unfortunately, there are quite a few anorexics who did used to be at least mildly overweight, and so they get a lot of praise when they do start to lose some weight from family members and from friends. Irregular menstruation, fainting, and dizzy spells. There are 2 reasons high school girls faint. You want to guess what they are? Eating disorders and pregnancy. That's just about it. I guess dehydration, I suppose. I should put 3 in there. But that's the first 2 questions that school counselors ask when a girl passes out of school. And if your daughter talks about feeling dizzy and, or your son, because there is a percentage of the population that could struggle for men, about 10% of anorexic bulimics are men. You need to consider the idea of an eating disorder if their child is talking about a lot of dizziness. Difficulty eating in public, very secretive about eating patterns, pale complexions, although that's much harder to hide since tanning has become very popular. It can hide a lot more of that. Headaches are real common, both from, I would guess, probably blood sugar issues and maybe some other medical conditions, as well as the stress, because you've got to keep in mind that frequently they are under perfectionistic type of people that are driving themselves very hard. They do a great deal to please almost everybody else in the world. People love most of my anorexic clients until they get to the really grumpy stage where they're starving themselves. They are very pleasant people, but they get headaches frequently. Feeling of self-worth is determined by what or what is not eaten, and there's nothing to explain why they're losing the kind of the weight that they talk about. So those are some things to pay attention to, for the families. There's lots of medical things that I could go into, including hair loss. Because if you look at it from a body standpoint, nail growth and their skin, those are things when their body's going into starvation mode, but that's expendable. You can live without hair. A lot of women would disagree with me, but you can live without hair. That's why their body stops their periods. They can live. It's not a necessary function. And their skin changes its complexion. I've only probably ran across it maybe 3 times, but their body will compensate for the severe difficulty with regulating body temperature by developing this fine hair that grows all over their body. They call it lanugo, I think is how you pronounce it. And it's kind of disturbing when you see it. There's also, in addition to being severely dehydrated, they also develop edema, where their hands and feet and face sometimes will swell and retain enormous amounts of water, which causes lots of psychological issues because now their weight's going up, but their body doesn't trust them to be taking in water, so it holds it, which is part of the problem with the whole diuretic and the laxative issue, that initially they feel like they lose weight because they lose all that water weight, but their body compensates by not letting them flush out any more water for the next 24 to 72 hours, so they start retaining it. And then their weight goes back up, and so they use the diuretic again. And it becomes a very dangerous cycle. Those are conditions that need to end up being treated medically. Insomnia happens a great deal for these individuals. And I remember reading some research a while back that had to do perhaps with wondering about their thyroid being impacted by it, but I am not certain that it's completely medical versus some psychological reasons why they're not able to sleep, or the fact that a lot of their food patterns or intensive exercising patterns happen in the middle of the night. And I can see Dr. Henley's brain is spinning over there about it, so if you come up with some ideas, let me know.
Yeah, let me think about it. We talked about sleeping disorders last time with Dr. Boschrap, and melatonin and just the circadian rhythms and stuff that your body goes through, and I'm sure it has something to do with that, but I'll have to think about it for a few minutes.
Well, they're having difficulty with temperature regulation, and not just because they lose body fat. There is some research that supports some of the thyroid issues and perhaps some pituitary gland issues. Again, that's out of my depth of expertise.
You see all those, the thyroid, it's all involved in metabolism, so your metabolic rate and everything else will be adjusted depending on your starvation, if you're going into starvation mode. So it's all connected somehow, it's just that it's difficult to figure it all out, right?
What we talk a lot about actually in my practice is the mind-body connection. Our mind and our body are very much connected, we just don't always know how. But I can get many clients that are kind of skeptical of that whole concept. We'll agree, okay, yeah, they have worried themselves literally sick, made themselves vomit before a presentation, and they know they can give themselves a headache or migraines. They can accept those type of things are related, but we know immune functioning is very much related. I used to get sick every freaking Christmas vacation from college, and it was finals, pushing myself all the way through finals, poor sleep. You know, it's like my body knew I was going home, and I had like 2 or 3 weeks off, and I would get like every darn time until I finally figured that out, and then did better at planning. So, and I'm going to go through now the things to look for bulimia, but in my opinion, a lot of them are very much the same. There's high need to please other people. They actually still have a lot of performance-based issues. They are also very afraid of gaining weight. It just doesn't reach the phobic level, typically. The anorexics feel that bulimics are often very much afraid of gaining weight. Avoidance of restaurants and planned meals or social events that form around that. I had one gal that her sister was getting married, and she couldn't believe how much food was relative to that whole process. You know, with the bridal shower parties, and then the rehearsal dinner, and then actually at the wedding, and she had to sit up in front of those people on that one big table that the family sits at, and had to eat in front of people. And unfortunately, with her eating disorder status, the mom, who was over-involved, announced it to the family that we're struggling with this illness, but we're going to be a family, we're going to work through it. It was the worst possible thing they could do, so she was living in a fishbowl during the whole time. It was really not helpful. I probably should have mentioned this earlier, substance abuse. This group, probably all 3 of the disorders are at risk for substance abuse. And a lot of times, it's another effort at a coping skill or an effort at kind of fitting in. It's never alcohol as much of an issue because they know about the calories. At least not with anorexics, bulimics, and binge eating disorder folks might struggle a little bit more with that. But it tends to be medication. It tends to be pills. And I've seen more of an issue with that with folks who use diuretics and laxatives. The people that already are kind of going through the process of taking a pill to fix something are a little more at risk for engaging in other behaviors. They don't like pot much at all. I guess you could think about that if you know much about marijuana. It increases appetite.
Makes you hungry all the time. So along those lines, do you think an anorexic would be a higher risk to use amphetamines and stimulants like that would decrease appetite?
Yeah. A lot of like dexatrim and things like that. I don't even know if that's even still on the market. That used to be something that was a huge issue, and it would be something that a lot of parents would go through the rooms looking for on a regular basis. I had one girl that would put it inside a Tootsie Roll. And she ate Tootsie Roll. The parents were like, it's got calories at least, so they would let her do it. But she would put this big fat Tootsie Roll and shove it inside. She referred to it as her blunt, which if you know anything about marijuana use thing. Never mind, I don't want to educate. Sorry. Moving on. Sorry. Okay. This is a treatment issue, but difficulty expressing their feelings. It's not unusual at all for me to have to spend session after session. And initially I used to think it had to do with the fact that maybe we weren't therapeutically bonding, maybe we weren't connecting, maybe they didn't like me. When I'd ask them, how are you feeling today? Well, my stomach hurts. Well, but emotionally, how are you feeling? My stomach hurts, so I'm unhappy. Like they would have physical, they just couldn't connect to a lot of their emotional state. And if they did, they had a really hard time being vulnerable and expressing it. And so that becomes a whole other subset of treatment issues. And vulnerability is just not something they're good at. At first, I was hesitant to list this criteria because I thought it wasn't quite accurate, but I started looking back over some clients over time that possible conflict over gender identity or sexual orientation is something to pay attention to, particularly for bulimics, more so than anorexics. And I think it really has to do with just developing identity. When you think about a lot of these gals, and guys for that matter, really are struggling with who they are in general. And it's an issue that becomes, that age, that is the time that people do start telling people, or really they often know long before they hit their teen years, that they might be interested in a different sexual orientation. But of the men who have come in for treatment, particularly for bulimia, I would say 50% or more of them have been struggling with coming out to their families. They are gay, and it makes sense that they might list that among the criteria, but I'm not trying to say that everybody who's struggling with bulimia could be struggling with gender identity issues. So I didn't want to give that impression.
Dr. Dalton, you might want to differentiate between sexual orientation and gender identity disorder. I don't know if everybody knows what gender identity disorder is and how that's different. It's sometimes different than, well, it is different.
It is
really.
different.
Yeah.
It is different. Sexual orientation is like, I'm heterosexual. I'm interested in the opposite sex. Same-sex interest is homosexual, or bisexual. They have interest in both. That's sexual orientation. Gender identity is where correct me if I'm wrong, but is where they feel that they've been born the wrong sex. Mm-hmm. That they have their whole lives almost always felt like, even times when they were toddlers, and their parents will come in and talk about, I couldn't get a dress on her to save her life, and she was 2. She hated it. Or my little son has never wanted to play with toys. He wanted Barbie dolls. The sweetest gave up and broke his dad's heart. And coming to the teen years, and they're telling us, I don't feel like this is my right body. Something was wrong. They spend a lot of time. I have a lot of the teenagers that I have met with this. They come in with questions about wanting to know if perhaps their parents had a choice at birth, or a specific condition where perhaps they were born with both genitalia and their parents chose the wrong one, because when the surgeons get to correct it, and that almost never is the case. So gender identity is where they feel like they are in the wrong body. And interestingly enough, as a separate topic, like if a woman comes in and she feels like she's a man and she's interested in a woman, she does not consider herself a lesbian.
Mm-hmm. That's correct.
She considers herself straight. She's just in the wrong body, and frequently they go for sex reassignment surgery, which is a lengthy and painful process, and the insurance companies make it very difficult for them to qualify for it. And I think it's even still listed among the psychiatric disorders, which makes it even harder for them to get treatment.
Gender identity disorder, yes, it's a psychiatric disorder.
Something to look for, particularly with bulimia, but also with the binge purge type of anorexia, this is like the telltale sign. This is when they think that I'm like some sort of genius, but I look at their hands, I look at their nails, and I look at their knuckles, and there's frequently abrasions from them gagging themselves, because their teeth, they have like a natural response where they clamp down, they push their hands so far back into they're scraping their knuckles on their teeth, and from the acids. And then frequently their nails are very brittle, as well, but from their purging. And their body adapts. Their body stops letting them get sick. After a certain point in time, they have to put more and more effort into it for many people. Unfortunately, some people develop a very easy gag reflex where they just have to think about it and get sick. But there's many a person that I've treated that they can't get sick, and so they have to go through extreme measures to do so. Okay. Essentially, most of the criteria that you could look for binge eating disordered folks really would have to do the rapid weight gain and eating at inappropriate or unusual times, large amounts of food missing, a lot of hoarding of food, although that happens with bulimics as well. Actually, anorexics occasionally do it as a control factor. They will buy or grab boxes of Twinkies and keep it in the room just to see if they can have the temptation and not do it. But for the most part, hoarding behavior actually has to do more with bulimia and those sort of things. So if you know someone who's hoarding a great deal of food, then it's something to pay attention to. So, a couple of last things that I wanted to go into is things to pay attention to as parents, as family members or friends with individuals that may or may not be struggling with these issues. As a general rule, things that I'm talking to with parents of young children, at some point I have a conversation about, do you have any idea how much you talk about your body image in day-to-day conversation? And I'm going to admit, I feel like a hypocrite sitting up here because I had a baby 11 weeks ago, and I'm complaining about nothing fits. And this outfit makes me look fat. I can't fit into that one. These are my fat clothes. And that's not good. I got a 3-year-old child who's absorbing it, a 3-year-old daughter, no less, who's absorbing it. So we have to pay attention to those kind of things. But what I encourage parents to do when they want to know, how do I avoid this? Or it runs in our family. Or I struggled with this as a child, or I really could have had a problem if I hadn't have gotten help for it. How do I stop this from my daughter, my granddaughter, from developing these symptoms? And one of the things that I encourage them most is to pay attention to their language. What are they talking to their children about it? Because it's really about, the best gift you can give your child is self-esteem. The best thing, the best parenting tool that you can give them to help them recover and survive from just about anything is a good sense of self-confidence, what we call self-efficacy, which is a belief that they can take care of themselves, and a sense of self-esteem. That's the number one thing that any parent can do. And I think we lose focus of that so much in our world with getting involved in sports and having to be almost always two-parent working homes. And remember that exercise that we strongly encourage to do as a family is for the purpose of being healthy and keep taking care of our heart and our body, not necessarily for losing weight, because that's then setting them up to look at exercise as a weight issue. We want to talk about, they actually recommend not labeling good and bad foods. Like really fatty foods, this is a bad food, don't eat this, because they don't want to start thinking about, well, if I eat fatty foods, I'm going to be fat, I'm going to be bad. That's the connection that they make subconsciously with that. And unless your pediatrician tells you to pay attention to your child's caloric intake, let their hunger dictate what they eat for the most part, or at least how much they eat. I should say what they eat, but I think no, my 3-year-old no. She would spend all day eating candy and those darn little sugary treats at Walmart that are always up front. So you do have to pay attention to what they eat to a certain extent, but really the amount of what they eat, unless you have a pediatrician telling you that they are having unhealthy weight gain, or they're already overweight, or there's a genetic condition that you need to pay attention to, let their hunger dictate it. And then encourage activity as a family. We do encourage meals together as a family, where you just talk about life and reconnect over food. And so it's not as much of an issue where they can go into their room or avoid meals altogether. When people come in to my office, by the time they've reached that level of, there clearly is a problem, and I often find that there's a family member that is just too involved. Usually it involves treating the whole family collectively, and oftentimes it does involve treating that parent, them receiving their own therapy to address perhaps what the need is that is becoming so intense of a relationship with their child. So those are the primary things to look for when people say, what can we do to stop this? Fathers have an enormous role in their daughter's world, and their daughter's world of self-image, especially as a woman. And I think that gets missed a lot in families. Fathers get very uncomfortable when girls start reaching closer to the teenage years, and they start wearing bathing suits, especially if they start looking good in bathing suits. It really disturbs fathers, and they avoid it. They don't want to talk about it. They don't want to be around their children when they're wearing bathing suits, or where exercise is involved a lot of times when they've reached that point in time in their life. And it's actually we're attributing some of the decline in self-esteem for women with the disconnection with their fathers in our culture too. And so that's another thing. I guess another factor when we talk about prevalence and what does this look like, pretty much in every industrialized country, the rates are pretty similar. For the statistics about what people, it's probably a little bit worse in America, just like everything else seems to be when you look it up. But just about in every industrialized nation, so every nation that we would consider sort of comparable to us. And in the developing nations, we're seeing more. The more influence that there is becoming of the Western culture into their world, the more it's happening. And we can attribute it to any number of things if we want to, but the reality, a lot of it comes back to self-esteem, with conflict frequently in families, emotional restriction, and our media, which I could spend all day talking about that, but it's 8 o'clock, so I will stop. But our media is not helpful. It is not helpful. And it is very unrealistic what so many of these people in the media look like. And when you talk about the model, what was the recent one? Tyra Banks. Is that who I'm thinking of? She has her own talk show, I think, right? Yeah. I mean, she got up to a size 8, heaven forbid, and the media was just all over her. Oh, she looked great. And she got on there and talked about how great she felt and was comfortable with it. And I thought that was one of the best things that could possibly be done for it. Because in years past, she would have probably just disappeared until she lost the weight. That's what her managers would have told her to do. That's what her world would have told us to do. As a separate aside, one other thing that's sort of coming up in treatment for eating disorders is that if you look at a lot of the research, there is a lot of support for comparing eating disorders, particularly anorexia, with addiction treatment. Because there's very much sort of a reward cycle system that we think that works in the brain, and it kind of makes some sense. And as a result of that, there is recently developed in Indianapolis a 12-step program that focuses now on eating disorder. And a lot of the literature talks about when you're talking with your family about these substance abuse, that they kind of support talking about using food in that way. And the family's not using food as a reward or a punishment. And how often do we do that? Myself included, Circus Peanut, I rewarded my child for peeing on the body today. And I'm getting ready to go to a talk about it, and I just did it. I rewarded her for good behavior. And candy, no less. I should have taken her for a walk, which she probably would have loved a great deal more. But it required time and effort on my part. And I think that was where I failed as a parent. And it's just a little thing, but it's something to pay attention to. And it's easier to do so many things that aren't healthy. We need to sort of take back that initiative in our own lives. But the best thing you can do is to teach your children about self-respect, self-esteem, talk with them about loving yourself and accepting people and not basing it on appearance and doing the same darn thing yourself. Because if you're not a good model, they know. Kids know a lie when they hear it. They have really good noses. They can smell it. So, any questions? You guys want to ask anything since it is about time probably to wrap up if I had to guess? Nothing? I've covered it so effectively.
I have a 6-year-old that eats all the time.
Okay.
And she doesn't choose healthy things, but is she eating out of boredom or is she hungry? And a lot of times I'll say, oh, you're just bored. Let's go do something else. But that kid begs for something to eat. And it's not like I lock it in the cabinet and say, no, you can't have it. Because I do let her graze. I mean, to the point where supper comes and it hardly gets touched.
Well, I was going to say, you probably do want to implement meal times and some structures relative to that, not rigid structure. Because if she's not eating with the family, if she's not...
We all sit down,
but she's not
she
eating.
picks, and then she leaves in her plates, 3/4 of the way. It's still there.
Yeah. That could develop some problems, not necessarily a true eating disorder, kind of like precursor to that. But like the physicians would say, don't let their appetite dictate them. But her appetite is not being used at appropriate times. So it might not be necessarily boredom, but she's not developing the appropriate hunger signals. Which that's another thing I can talk about with severe anorexics. They lose their hunger signal. They don't feel it after a certain point at all, and it becomes another separate part of treatment. We have to help them become more aware of it again. At 6 years old, that's probably not the case. But it probably is more important to talk about maybe family structure, to it. But especially if she's making healthy choices, that's great.
Yeah, she's not chubby or anything. I mean,
Yeah.
It's just that he eats all the time.
But not at meals.
Right, exactly.
But that's
And
significant.
even at mealtime, I'll say, if you don't finish that, you don't get a snack until 7 o'clock. And we eat at 5, so that's a 2-hour stretch. And by 6:30, she's down in.
Okay. Well, you might want to find what works for her, but you might have to do some experimenting, perhaps on it. But I would definitely probably pay attention if she's not going to eat at the meals, because then she's going to be hungry, like you said, later, afterwards, and that's going to be setting up a time that could be an issue. So. Any other questions? Did you have a question?
If you eat for comfort, is that a disorder?
Well, if it
You're
is, most of
anxious or
us,
something, and you just, I know I'm
do
going to
that.
feel better if I eat this chocolate cake.
Do you feel better if you eat the chocolate cake? That's the question I ask people. Do you
I
feel better?
feel comforted, but then I'm mad at myself.
While you were eating it, you feel good.
Yeah.
But immediately afterwards, remorse, shame,
Then
disappointment.
I wish I was
frustration.
bulimic.
See, that's what I'm talking about. Darn it, if only I was good enough. Then I would say that you are probably doing what almost all of us do. But you're using it as a coping skill, and it's not a healthy one. Now, there's worse ones. And if you do it on a regular basis, that could be an issue. What I tell people when they come in and they want to talk about how do we healthy diet, how do we do it appropriately, as I encourage people, before you eat, first of all, you keep food in one location. You don't have it throughout the house. Keep it in one location, and before you go to eat, you ask yourself, what am I feeling right now, physically and emotionally? Am I bored? Am I upset? Do I want to smack my husband? But what could be the issue? And if I'm hungry, go eat. That's fine. Whether it's a mealtime or not, probably. But if you're not really hungry, then why are you eating? Oprah always talked about throwing a party in her mouth when she would feel down. That when she had to stop doing that is when she was able to maintain good weight recovery. So.
But shouldn't you only eat if you're hungry? I mean, I get talked to about this a lot. Not by my family, but like some people around me about not, because I don't eat I've never eaten 3 meals a day. Sometimes I might only eat once a day, and I might not eat much. But if I'm not hungry, I don't see the point in eating.
Well, I'm sure that dietitians would have quite a bit to say about that, because you do need to get all your nutrients in, and it's not likely you're going to be able to get all your caloric and nutrient intake in with 1 meal a day.
Because I probably do have an eating disorder, but it wasn't included in any of those that you.
So disordered eating,
Yes.
perhaps might be what
Yes,
we
I
talk
fit
about.
into the disordered eating part. But if I'm not hungry, I don't see, if you eat and you're not hungry, then you have a sick feeling. Or I do, you have an uncomfortable feeling because you weren't hungry to begin with.
Well, I mean, I'm not saying that you necessarily have to have a full 3-4 course meal, but making sure you're maintaining your caloric intake, especially if you're still active. You know, if you have to, it has to match what you're taking in versus what you're burning out. And that's where weight loss obviously is going to happen in an unhealthy way if you're not taking in enough.
You normally suffer with that, but you also have to burn more than what you take in too to keep from getting bigger too.
They recommend what, 1,800, 1,750 to 1,800 is probably what they're going to recommend, which is good. And I'll encourage people actually to do that. But
well, and like she was talking about with the kids, is it healthy for you? Because I've always thought that it was probably unhealthy to eat late at night. You know, to have like a bed. I don't believe in bedtime snacks because that's, to me, I've always heard that's bad for your digestive system. Is that true?
actually, there was a pretty interesting study that just came out that we talked about how diets don't work. And one of the things they talked about is that your body doesn't know what time it is. The calories don't know what time it is. Actually, your body kind of does know to a certain extent.
Because your metabolism drops,
it does
start
slow,
slowing down.
But they say not as much as we think that it does. It is an issue in terms of for your heart. It is not healthy to have significant meals before you go to bed because it's a lot of work on your heart. And that's probably a better question for the physician. But it is something that we don't encourage is late eating. But they talk about it that one of the healthiest diets is what we used to do like 1,000 years ago, which was sort of the hunter-gatherer type of phase, and people ate every 3 to 4 hours. That's what we think, and it maintained a healthier metabolism, throughout the rest. But an additional factor that I probably should have talked about is a primary treatment issue. Once we address dangerous eating behaviors and get on a healthier schedule with eating, is we address what is almost always present with any of these eating disorders is anxiety and depressive issues, and those things can significantly impact your appetite. And so those are things to be aware of as well. So if you talk about not really having much of an appetite, you need to know if you're the type of a personality or an individual that could struggle with either of those traits at all that could suppress your appetite. And then of course, no, you wouldn't be hungry, but if you were the type of person who's real anxious and you're not hungry, you could waste away to nothing if you just based on your hunger signals. So there's probably a few things to talk to somebody about. And as a general rule, when people ask me, how do we know when I should talk to somebody? When do I seek treatment? And what I said, this is true probably for any diagnosis. There's 3 questions that I have people ask themselves. First of all, do you wonder if it's an issue? Then yeah, you should go talk to somebody. If you're wondering, go talk. If somebody else tells you, you should go talk to somebody, or they're wondering if it's an issue for you, go talk. Or if it interferes with your functioning in any way, whatever it is. If it interferes with the functioning, academic, occupational, social, sleep and appetite, if it interferes with your functioning in some way, you should go talk to someone. And so that's a rule that probably applies for any diagnosis. Good questions. Thank you for asking.
Any other questions? Well, thank you, Dr. Dalton. I very much appreciate you coming tonight. These last few sessions, these are topics that I'm not necessarily an expert in. I don't even know what an expert is, actually. I don't have much knowledge in these things, and so I have brought in external experts, and you just happen to be the last one for the last episode of It's a Brain Thing. So, and I want to thank you guys. Exactly, I said your best for last. That's right. Don't tell Chris that, though. He might watch this on the internet.
Second best.
Chris and Dr. Bozier and Dr. Dalton are partners, so they'll see each other. So if we give him too much of a hard time, he'll know about it. But anyways, thank all of you. I thank all of you guys too for coming out and supporting us, supporting this every month, and hopefully you got something out of it. I think folks from around the world have. I just got a message on the internet from I put it on YouTube, and just a real quick story. A counselor from the United Arab Emirates, I assume it's Saudi Arabia.
I'm going to guess.
She sent me a little message saying that she's working her way through the videos and watching them, and just wanted me to know that I reached, all the way over to the Middle East. So, yeah. So hi Nadia. Thanks for the support, and hopefully there's other folks around the world. I know there are folks from Australia and China. I've heard from people all over the place. So Sweden, yeah. So some pretty neat stuff. So hopefully folks will get something out of this. And if you missed any of these, you can always get on the internet, and they're all on there now. So any of the topics that you want to hit and watch over again, you can do that. So again, thanks very much, and everybody have a good evening.